So good afternoon, everyone, and welcome to the National Hispanic Council on Aging's virtual Capitol Hill briefing. My name is Cindy Padilla, and I am the chairwoman of the National Hispanic Council on Aging Board of Directors. And again, it is my pleasure to moderate today's virtual event and to be part of the release of the executive summary of the 2021 status of Hispanic older adults, insights from the field, COVID-19, Latino experiences, perspectives, and realities. Thank you for joining us today. Every year, NHCOA takes the pulse of the Hispanic older adult population and presents an annual status report of Hispanic older adults. The report is a data and testimonial-driven status report with policy recommendations that capture pertinent hardships and challenges that Hispanic older adults are facing. In 2021, NHCOA decided to focus the report on the still ongoing COVID-19 pandemic and how it has affected and continues to impact the Hispanic Latino community. The status report is based on data, testimonials, and conclusions drawn from a series of multiple focus groups and surveys conducted virtually throughout the United States and Puerto Rico. The focus groups and surveys focused on collecting information regarding current situations and experiences of older adults, their families, caregivers, and Hispanic Latinos in general regarding the global pandemic. NHCOA is truly grateful to so many who have contributed to the 2021 status of Hispanic older adults insights from the field. This report was produced with the support of several organizations and individuals, all of whom are committed to the well-being of Hispanic older adults, their families, and caregivers. Their assistance was invaluable in collecting data, formulating recommendations, and preparing the report. A special thanks is extended to the participants in our focus group. These participants included older adults, caregivers, and service providers who gave their time, shared their personal stories and perceptions, and provided some recommendations. We would also like to recognize the NHCOA staff members who contributed their time and effort to the development of this report. For those who would like to read the report, it will be available on our website and our social media platforms following this virtual briefing. Today, we welcome a panel of experts who join us to provide context to the executive summary. Together, we will discuss the findings from the caregiving perspectives in the pandemic and the long-term effects of COVID-19 among Latinos. We are happy that all of you joined us this morning. It is critically important that together we ensure that all our nation's older adults can enjoy their golden years in dignity, grace, security, and in the best possible health. This virtual advocacy day would not be possible without the generous support of our many sponsors. So we would like to thank Pharma, Verizon, Lilly, the Pfizer Foundation, Bio, and the CDC Foundation. To begin the virtual event, it is my pleasure to introduce Stacey Sanders, who is the staff director of the United States Senate Special Committee on Aging. As staff director, Ms. Sanders oversees the committee's team and advances a broad-based policy agenda to enhance health and economic security for older Americans and people living with disabilities. We are truly grateful for their continued dedication to improving the lives of older adults all across America. Stacey, thank you so much for joining us, and we really are looking forward to hearing about your current work.
Thank you, Cindy, and thank you to Dr. Cruz, to Cindy, and everyone at the National Hispanic Council on Aging. NHCOA does such incredibly important work, and that is just reinforced today by the release of this report. I just wanted to reflect for a few minutes on the work that Chairman Casey has done since he took over leadership of the Senate Special Committee on Aging and share some of the priorities that he has been focused on. This report being released today by NHCOA is very timely and very much tracks with a number of the priorities that Chairman Casey has focused on as he's taken over the lead role on the Aging Committee. In fact, our very first hearing on the Aging Committee focused on the needs of older adults at that moment in the pandemic, with a special focus on communities of color and access to vaccines. And the chairman has done a tremendous amount of work going throughout the state of Pennsylvania, working to educate communities, all communities of older adults, about the importance of the vaccine. And one of the things that has been very important to him is that we educate communities based on science, and then we draw on verifiers, trusted messengers, in order to deliver that message. So I'm glad to be here with you today and to highlight some of those items in the report that have been particularly important to Senator Casey as he has worked with partners to spread the word about the COVID-19 vaccine and the importance of vaccinations. So education on COVID-19 as well as other matters continues to be a core element of the Aging Committee's work. But the chairman has also been very focused on securing legislative achievements on behalf of these populations. He was proud as part of his agenda to lift up some important investments that were made as part of the American Rescue Plan to help older adults, including Hispanic older adults, including funding for nursing home strike teams to manage the COVID-19 outbreak in those settings, funding for Older Americans Act programs, which included an emphasis on vaccine outreach and education, and partnerships between the Aging Network and other community members to reach some of these communities, as well as an emphasis on funding for home and community-based services. Those are services and supports provided in the home through Medicaid. And all of those investments in the American Rescue Plan are now being considered as part of President Biden's Build Back Better budget. And Chairman Casey, and here on the Aging Committee, we have been very focused on investments in long-term care, and specifically in home and community-based services. The senator was proud in June to introduce legislation along with 40 senators that would make a historic investment in home and community-based services, both to expand access to services among people with disabilities and older adults, but also to lift up the vital workforce that provides these services and provide them with wage increases and better benefits to deliver these services. We know that the vast majority of older adults prefer to age at home, and they want to do so with access to home and community-based services. And in addition to helping the workers who provide this care, the seniors and the people with disabilities who rely on these services, another really important population for the senator and a focus of this investment is family caregivers, because so many family caregivers in our communities are shouldering the burden of caregiving without adequate support. And this investment would allow them to go back to work, and it would support them in really important ways with training and respite and other services. So the chairman has been very focused on carrying forward that historic investment, and he sees it as just one of many things that Democrats are doing in order to advance equity, particularly for communities of color, but also for other low-income populations that traditionally have not had access to the services and the supports, and in this case, the wages that the workforce deserves. In addition, the senator was really proud to introduce legislation to enhance the quality of care in nursing homes with a focus on staffing, as well as accountability, as well as the Elder Justice Act reauthorization, which highlights another theme that was raised in NHCOA's report, which is social isolation. This legislation would provide funding to specifically address social isolation and loneliness among older adults in all communities. And I think I should say, just in closing, one of the reasons that NHCOA is such an important partner to us and their work it really informs a lot of what we do, is that the chairman really has wanted to ensure that the work of the Aging Committee lifts up the voices of older adults who traditionally don't have a voice in the policymaking process. and who have struggled to make sure that their voice and their perspective and their needs are heard. So the chairman will continue to strive to make sure that Hispanic older adults are a part of the work that we do on the committee, that their unique experiences and their stories are a part of the educational work that we do, but also that we have front and center their needs in mind as we develop legislation and we work to advance critical improvements, including those in the Build Back Better budget. So again, really happy to be here, really grateful to NHCOA for all of the work that they do and for the release of this important report. And I look forward to hearing more from our panelists.
Thank you again. I really appreciate the senator and the senators and the committee's focus on really wanting to hear voices and giving voice to older adults who so oftentimes have been marginalized or really haven't had an opportunity to give their opinion and their perspectives. And that's one of the reasons why we're so excited and we always like to present our report, because the report is not just about data and information, which it definitely includes all of that, but it's about hearing the voices from our focus groups and from our participants from across the country, in Puerto Rico, places where so oftentimes, you know, our people are feeling like no one's listening, you know, no one's hearing us, no one's seeing us. And this report is definitely a voice for all of our older adults living in those communities. So again, thank you so much, Stacey, appreciate that. So based on evolving data, it is evident that the COVID-19 pandemic continues to dramatically impact Latino communities. The pandemic has hit hard some of our most vulnerable, including isolated seniors, immigrant communities, Latino families, and single-parent households living paycheck to paycheck, and small Latino-owned businesses. The disparate impact COVID-19 has had on these groups further highlights existing health inequities that are born out of systematic and structural racism that has existed for centuries in the United States. These systemic and structural inequities result in financial insecurity, substandard housing, poverty that does not allow for financial planning for emergencies, and jobs that cannot be done remotely or do not offer health insurance or paid leave and have potentially limited access to health care. These realities lead to many of the conditions that heighten the risk for becoming infected with COVID-19. To understand Latinos' knowledge, attitudes, beliefs, and behaviors regarding the COVID-19 virus and the COVID-19 vaccines, NHCOA held a series of virtual focus groups in English and in Spanish. And so now we would like to discuss these important findings. Our first panelist is Yvonne Rivera. Ms. Rivera has over 15 years of experience in qualitative research, design, development, training, evaluation, and implementation. Yvonne's consulting practice focuses on providing services to organizations in the design and development of focus groups and key respondent interviews, intercept interviews, cognitive testing interviews, evaluations, shop-alongs, and quantitative community surveys. We are giving our people a voice. Ms. Rivera has worked extensively with the African American, Ethiopian, Asian, and Latino communities in the DC metropolitan area and nationwide in the areas of interpretation, translation, training, forum and group facilitation, outreach, health education programs, and evaluation. Today, Ms. Rivera will speak about the findings of the NHCOA's COVID-19 focus groups reports. Yvonne, thank you so much for being with us, and we look forward to hearing your report. Thank you for joining us.
Thank you so much. It's such an honor for me to work with NHCOA. I fully support and I'm very passionate about hearing older adults' voices. So let me share what we heard during the focus groups. Next slide, please. So as you heard, the purpose was to listen to those voices that are hardly ever heard, and to listen and try to understand the knowledge, what they are, what they know, their attitudes, their cultural beliefs and behaviors regarding COVID-19 virus and the COVID-19 vaccines. Next slide, please. So we stratify focus group by age and primary language spoken. And we ran 6 virtual 90 minutes focus group of 8 to 6 participants, or a total of 42, from Puerto Rico, Los Angeles, Houston, New York, Washington, D.C., and Silver Spring, Maryland. I have to say that from Puerto Rico, we had participants, they did an excellent job. We had participants from throughout the island, which was wonderful. We didn't solely hear from San Juan, but from other remote areas of the island. The ethnicities were Salvadorian, Mexican, Colombian, Dominicans, Hondurans, Bolivian, and Venezuelans, Americans. So we had a variety of country of origin, ages, and mostly elder adults. Next slide, please. Let's talk about the personal and family experiences with COVID-19 that I heard during these groups, and most of the focus group participants had been impacted by COVID-19, either firsthand or through their close relative and friends. I remember one of the participants breaking down during the focus group. She was from Texas. Within a month, her brother passed away, her mother, and then her father of COVID-19. And another woman from LA sharing how 28 people from her network had died of COVID-19. And they were really sharing their pain and suffer through this pandemic. And like they said, we're still going through a pandemic. Well, many reported surviving the COVID-19 virus at their homes without seeking any medical attention. Why was this? Some of the reasons we hear is that they were just being turned away. There were too many people at the hospitals or emergency rooms, and they were turned away. Or that was early in the pandemic, or having no means, or either no access to medical care or insurance, or just being afraid of seeking medical care, and being afraid perhaps associated with lack of immigration status and being cut. And many participants also reported many rely basically on homeopathic traditional remedies to overcome the virus and strengthen their immune system. So we heard all the things they did, had tea with lemon, garlic, and these different cultures and how they dealt basically at home. Entire families that came down with the virus, and of course the chicken soup, very traditional. Next slide, please. Let's talk about the physical, emotional, and financial impact. Most of the younger adults participants, both COVID survivors and not, reported being in fair physical condition. But older adults who survived COVID-19 infection reported suffering from hoarseness, trouble breathing, body pain, and weight loss. And 2 or 3 months or many months have passed, and they're still dealing with the sequences of this pandemic, of this virus that hit their body and sent them to bed for many weeks. Also, the participants, we hear a lot of fear at the beginning, a lot of uncertainty, confusion during the early days of the pandemic, and they added, of course, the financial struggles that they had. Like one of New York participants said, we're still in pandemic, not only because of the virus, but because of the financial impact that our community has been hit with. They talk so much, elderly adults especially, about social isolation and the stress from confinement, not being able to see their grandchildren or their families at all, and being just isolated and becoming so much depressed in depression. The limited social contact was particularly detrimental among Hispanic older adults. They expressed how they felt so isolated, so lonely, missing their family members. And some of them expressed being depressed for many months. Many participants reported continuing to work throughout the pandemic, many expressing that they had no other choice but to go out and work. As frontline staff, working as drivers, home health aides, restaurants, grocery stores. Next slide, please. Let's talk about testing and medical care. Most participants expressed receiving COVID-19 testing as a result of requirements for travel and work. They really had to go out and work, or they wouldn't bring any money home, couldn't have any food, so they really had to take that metro and go, or any transportation that they had, public transportation, and go out and work. Some of them had to travel because of emergency situations with their families, and they were required to have tests. Participants reported the following issues with testing. There was limited availability of testing at the beginning of the pandemic. Also, lack of clarity, information, mostly in Spanish, and insufficient systems put in place early on. Many participants expressed improvements in testing over time. A major concern reported by many participants were the medical bills related to hospitalizations and medicines that resulted from COVID-19 infections. Next slide. Knowledge of information sources. Most participants relied on television, such as Telemundo, Univision, radio. In this area, they talk about Radio America, newspapers, local Latino newspapers, and the internet to gather information. But there was so much uncertainty and lack of information about COVID-19, the pandemic, and later on the vaccines. For official sources of information, participants listed the CDC, local and state websites, and the mayor's phone or web information as reliable and trustworthy. Next slide. Let's talk about vaccines. We talk about vaccines. Most participants that were part of our focus group identify as having been vaccinated and having a positive attitude about the vaccines. Participants who were vaccinated reported getting the vaccine because they wanted to protect their families. I heard this woman from Texas saying, I'm getting vaccinated because of love to my family and love to my grandchildren. And so it was also, some of them were required in order to go back to work and to be normal as possible. Other participants remained uncertain about the vaccine. The mayor's reasons cited for these concerns were based on misinformation and mistrust. Some participants also expressed just distrust of the government, particularly related to the way the government has addressed the health needs of Hispanics and other minority. And they mentioned the syphilis trial, and this Puerto Rican woman from New York expressed how there were massive sterilizations on the island that she heard of. Next slide. We talked about government actions, and in general, participants expressed discontent with the federal response to COVID-19 in the initial stages of the pandemic. But participants also noticing a big shift with the new administration. They were relieved, they expressed their relief and their content and happiness that it was moving, help was moving forward. They also had more positive attitudes regarding government responses at the local levels. Participants said they saw and provided for unemployed workers and renewed interest in closing the technology gap, which has been really a big gap among our communities, especially our elderly adults. Everything switched to technology, getting testing appointments, getting vaccines appointments, everything, all the information, and they had to rapidly, still struggling with technology gaps. However, most of the positive impacts were felt at the community organization level. People and groups came together to help and support each other in many, many ways, like NHCOA offering a toll-free number to offer transportation to get testing or vaccines. Next slide. Next step, we talked with the group about next steps. Participants believe there is still information lacking, especially in Spanish, in our own language. Also, there is need for more culturally appropriate, tailored campaigns, slogans, and efforts. The U.S. must shift focus from finances to health and well-being. The well-being is so important for our Latino participants. Their well-being and their families and grandchildren. Non-existent health inequalities came to light during the pandemic, but they expressed we already were very vulnerable about accessing healthcare in our own language, not being able to understand doctors in emergency rooms. And so it has been a long time. They express that we have been struggling with the system. Vulnerable communities can be aided through universal healthcare, and we all know that. More community health clinics and just universal healthcare. Next slide. We're continuing here with next steps. Major issues for participants. Financial burden, like they said, we're still in pandemic. We're still, because we have been hit so hard, we were not able to work for many, many months, and we're behind in mortgage, in rent. Some of them were not excluded from government assistance because of lack of immigration status. Big families with children not being able to provide for themselves and their families, and yet continue to work as soon as they could. They went back to work. Frontline workers, home health aides, and so relief is needed in light of the risks that they endure, serving actually U.S. citizens in restaurants, frontline at hospitals, at cleaning as nursing assistants places. Most participants experience the impact of unemployment, loss of housing, and overwhelming financial debt, and request government assistance for these issues are still going on. Participants recommended amnesty for people who are out of status, excusing student loans, especially they felt that they mixed immigration status family with U.S. children. Excusing student loan debt, an extended moratorium on evictions, protection for essential frontline workers, and employing systems that actually work. Next slide. Assisting with mental health is greatly needed. We heard throughout all the groups how they were so depressed and in need because their social workers were not being able to visit them anymore, or sometimes not even call. So they felt really isolated, in need. And many people started suffering from anxiety, stress, depression, and isolation caused by the pandemic. Especially, we heard a lot of this from our senior adults. Older adults requested actually access to psychologists or trained therapists who can come to them, have them come where we are, and help with coping with the new normal and assist with developing skills to deal with emotional change. This was, we heard throughout the groups over and over again about the emotional stress, anxiety, and depression caused among our participants and their families throughout the US and Puerto Rico. Next slide. Of course, for more information, contact us at email, NHCOA, and the office number 202-347-9733. If you have any questions, please. Thank you.
Great. Thank you. Thank you so much, Yvonne, for giving our participants such an incredible voice. As I mentioned earlier, this report is a unique report because it does just that. It really does give people a voice so that we really are hearing what they're feeling, their physical, the emotional, the financial impacts, and it really it makes a difference. So many of our government programs are designed based on data and science, and it needs to be, absolutely. But if we don't have that added influence of, what does it really mean to people living in our communities, then we're missing something. So thank you so very much for giving our participants that voice. I'd like to just remind our attendees that if you do have any questions for our presenters, we are going to have a Q&A session at the end of our presentations, and you can type your questions into the chat box, and so we'll keep track of them, and we'll try to get to as many of those questions as we can at the end of the session. So over the past year and a half, the COVID-19 pandemic has brought to light areas in which policy can have a major impact on long unaddressed issues such as health inequities, wealth inequities, access to health care, job security, mental health, and so much more. And as I stated earlier, the status report includes many policy recommendations. So we would like to turn now to Dr. Yanira Cruz, who is our president and CEO of NHCOA, to share with us these policy recommendations in regard to the Hispanic experiences with the COVID-19 pandemic. Dr. Yanira Cruz, who is our president and our CEO of NHCOA, is one of the nation's foremost advocates and spokespersons for diverse older adults, and has been recognized nationally for her commitment and her leadership on behalf of diverse older adults nationwide. Welcome, Dr. Yanira Cruz. Yanira, thank you so much for being here and for your presentation today.
Thank you, Cindy, for that warm introduction and for facilitating this Capitol Hill briefing once again. And I also want to take this opportunity to thank all the panelists for being here, for dedicating their time and their energy and passion to addressing such important issues that older adults and their caregivers are facing. So thank you to also our sponsors for supporting our work throughout the year, and especially this one effort that we do each year to take the pulse of our community. I also want to give a shout out to our board of directors, and of course Cindy is the chairwoman of our board, but also the rest of the board members, many who may be connected today and others who are doing wonderful work across the country, and also to our Business Advisory Council, who support our work, provide guidance to our efforts. So thank you for all you do. and also to the wonderful and mighty staff that the National Hispanic Council on Aging has. Thank you wherever you are working in different parts of the country. So thank you for everything you do. And also to the focus group participants who were willing to take part of the focus groups that we conducted with Yvonne Rivera in her office. So thank you for all that. So next slide, please. So the COVID pandemic highlighted the many ways in which public policy must be updated in order to serve communities that have historically been underserved. Next slide. The first policy recommendation is to work across the aisle at all levels of government to depoliticize the pandemic and the response. Communities of color suffered a disproportionate number of losses due to COVID-19, yet were left wanting for adequate COVID testing and neglected during the vaccine rollout. Politicizing the pandemic and the response to it was a grave misstep. We needed and continue to need a unified, consistent message on masking, vaccinations, and physical distancing. Next slide, please. Next slide. The second policy recommendation is to close the digital divide in urban and rural areas, ensuring that access to the internet and technology usage is not a luxury, but a right afforded to all citizens. The pandemic highlighted how important the internet is in modern-day healthcare and communication. Acquiring an appointment for a COVID test or vaccination should not be reliant on whether or not one can afford a computer and internet connection. Technology helped connect families who were separated by travel guidelines, providing a valuable tool to address loneliness and stay connected. As such, community-based organizations require help in training older adults in technology usage and implementing reliable internet in rural communities. Next slide. Our third policy recommendation is to continue providing financial assistance to individuals and to local and small businesses. The pandemic presented an attack of unexpected financial hardships to many. Frontline and service industry workers continue to put their health at risk for the sake of providing for themselves and their families, and should therefore be awarded wage benefits that recognize the dangers they are facing. And so, maintaining and implementing policies such as eviction moratoriums, student loan forgiveness and deferment, enhanced unemployment benefits, and pay leave go a long way in alleviating the financial burdens many Americans are being crushed under. Even now, many small businesses are operating on reduced hours or closing their doors due to the impact of COVID-19. Measures such as relieving tax burdens and employment support can help keep these establishments alive. Next slide. Our fourth policy recommendation is to improve the healthcare system with a focus on prevention and mental health. We urge the federal government to expand Medicaid eligibility to 133% of the federal poverty level if a state has not yet opted into Medicaid expansion. Community-based outreach to uninsured populations, a simplified renewal process, and expanded 12-month continuous eligibility are vital in promoting an equitable healthcare system. And it is becoming more and more apparent that the federal government must become more receptive to the idea of a universal healthcare system that includes a focus on the mental health care that is desperately needed by many. Next slide, please. Our final recommendation is to address misinformation and mistrust that impede vaccinations. It is critical that the government addresses the rampant misinformation that has been spread about COVID-19 and its vaccination, and work to foster trust among communities of color. Many of these communities have been victims of past transgressions committed by doctors and medical researchers, have not had access to culturally competent care, and have had their own traditional forms of medicine discredited and rejected by Western medical professionals. And so the government and healthcare officials should seek to work with community-based organizations to break through this mistrust and tailor their approach to speak to the communities they serve. And public health departments must work with these community-based organizations to offer vaccine clinics and bring vaccines to the communities that need them most. And this is especially important to older adults who face obstacles in obtaining care, such as digital literacy, language barriers, and a lack of transportation. Our last slide. Next slide. By working with community-based organizations, promoting universal health care, and forming a unified front to tackling COVID-19 and other public health issues, the federal government can begin to address some of the problems faced by many in our community. And for the sake of Hispanic older adults, their families, and caregivers, as well as Americans as a whole, we hope that the government and the administration pays attention to our policy recommendations and endeavors to serve every single American. Thank you for joining us and supporting our work. We look forward to working together with you to continue to improve the lives of older adults, their families, and their caregivers. Muchas gracias. Cindy.
Seems like, there we go. Thank you, Mike. I could not get my phone, my microphone off mute, but thank you so much, Dr. Cruz, for highlighting these incredibly important recommendations. And we hear trust is needed, access is needed, local home and community-based service organizations are needed. And we hope that so many of you that are listening today can pass these recommendations on to the people that you know. And we also are thankful that Stacey is here, as we mentioned, from the Senate Committee on Aging, because that's where these recommendations will be going. And we need to send them to Capitol Hill. And we ask that you all, normally when we have our Community Advocacy Day at our Capitol Hill briefing, we spend the afternoon going to our offices, and we ask all of you to go to the offices of your senators, of your congressmen and women, and share this report with them. And so we're asking you to continue to do that, to get this report and talk to the people you know, so that these recommendations can be heard. So Dr. Cruz, again, thank you so much for highlighting these recommendations for us today. It is a well-known fact that COVID-19 has disproportionately affected the U.S. Hispanic communities, and Hispanic caregivers have the highest reported prevalence of caregiving. For example, 2 out of every 3 caregivers in the United States are women, meaning they provide daily or regular support to children, adults, or people with chronic illnesses and disabilities. Women who are caregivers have a greater risk for poor physical and mental health, including higher rates of depression and anxiety. The COVID-19 pandemic can add even more stress to caregiving, particularly to family caregivers and also paid caregivers who provide personal care to older adults or people with chronic illnesses or disabilities at home. Our next speaker is Ms. Millie Lagreen, a multilingual journalist and communications consultant based in Washington, D.C. Ms. Lagreen has 16 years of experience in the United States, Latin America, Spain, and the UK. She is fully trilingual, English, Spanish, and French, and is fluent in Portuguese. Her work focuses on Latino immigration, labor, and politics. During the pandemic, she has written about the lack of protections for care workers, workers in poultry processing plants, and migrant farm workers. She has twice been backed by grants from the International Women's Media Foundation. Her work has been published by The Guardian, BBC, Mundo, Univision, and Telemundo, among other outlets. Today, Ms. Lagreen will highlight findings from the caregiving perspective in the pandemic. Millie, thank you for joining us today.
Hello, and thank you so much for having me. Thank you to the National Hispanic Council on Aging for inviting me to speak today, and especially thank you to Dr. Yanira Cruz for agreeing to an interview back in April this year, and to Pedro Lima and Christine Perez for helping me arrange interviews with caregivers for a report I did for Telemundo, which was published in May, called El Trabajo Invisible de las Cuidadoras a Domicilio. I also did an article for The Guardian back in 2019 about women in healthcare, and particularly with a focus on caregivers at home, home care workers. The article was called "Why Do 1 in 5 Home Health Aides Live in Poverty?" Yeah, there are both my articles. You're welcome to look them up. They should still be online. Next slide, please. So yeah, I'd like to start off talking about a little bit who these home care workers are. Who are we really talking about? So when we say home care worker, we're talking about personal care aides and home health aides who assist older adults and people with disabilities at home. So there's about 3 million of them, depending on whether they're independent or not. Most of them are women, a third of them are immigrants, over 25% are Hispanic. Many of them are older than 55, and a majority of them live in poverty or are near poor. So I read a recent study, and that was that suggests that both caregivers and their patients are vulnerable populations, and I thought that was important context for this conversation. Next slide, please. So these are photographs that I took for my report. Most of the interviews were anonymous, which is why there's a lot of headless pictures. So yes, it's one of the worst paid jobs in the country. The average hourly wage is $13.49. I interviewed a home care worker in Nevada who had 12 years experience. She was still earning $10 an hour. And another worker I spoke to said, we belong to the healthcare sector symbolically, but only by name, not in terms of our rights. So they're very aware that they're getting a really bad deal. And unionization is difficult. They have little access to benefits, little access to healthcare. One home care worker I spoke to from El Salvador travels regularly to Colombia for surgery, including during the pandemic. This has happened many times, and her story really was heartbreaking. She didn't have access to Medicaid for different reasons, and she was putting herself at risk through this job, and spending a lot of money going back and forth to Colombia, because she found it was obviously cheaper to get operated there than operated out of pocket here in the United States. Another thing I found is some of the workers I spoke to had an app that kind of tracked where they were at any time, so their employers could track where they were. And so whenever the employer, you know, could see that they were still at work after 7, 8, 9, 10 o'clock, they were owed overtime, and yet they were never paid overtime. Another thing, you know, if you don't work, you don't get paid. So if your client is in the hospital for COVID or whatever reason, you're not going to get paid that day, that week, those months. They're often contractor jobs, so a lot of these workers are hired by agencies. There's issues with lack of training. I spoke to several workers who are working 16-hour days to make ends meet. And understandably, you know, the turnover rate is extremely high. Workers are getting burnt out really quickly. They're lasting a few months and then they're moving on to something else. Yeah, next slide, please. Next slide, please. So yes, talking about the physical and emotional toll, this is something that's been talked early on today. It's, you know, it's obviously a very physically taxing job with a high risk of injury. You know, you're lifting heavy patients in and out of bed, into bathtubs, into wheelchairs, and so on. But I guess what really struck me was the emotional toll, the emotional cost. And so here, you know, I have a few quotes from the people that I interviewed. One of them said, "They used to tell me I was a servant. One patient used to do her business in the kitchen and the living room. They told me it was my job to clean it up." Another one would say, "One patient would get up at night and throw torn up bits of paper all over the house. I would pick them up when I arrived in the morning, but sometimes it made me cry." Another said, "Sometimes the patients have low self-esteem and they take it out on us. They can have mood swings." Another said, "Last week I took unpaid leave because I needed surgery. My patient called me all day anyway." And this one is particularly poignant. Somebody, I followed up with one of the women that I'd interviewed, and she said, "My patient made me promise I would look after her until she dies." So this talks a little bit also about the bond that some of these home care workers have with their patients, and that has all sorts of positive and I think it can also, you know, have an emotional toll on them for better or for worse. Next slide, please. Next slide. So yes, and then came COVID. So speaking of emotional toll and physical toll, one caregiver said that the worst thing about COVID was the anxiety it produced in her patients and the effect that had it on her. She was attacked by two of her patients who were really suffering during the pandemic, and she said, "I ended up in the emergency room because of stress." This was the lady in Nevada who was earning $10 an hour, who had 6 patients, and would, you know, spend her days driving around from patient to patient. And she was on her, you know, very low wage. She was also incredibly concerned that her car one day was going to break down and she wouldn't be able to work anymore. So, you know, obviously during the pandemic, there was a lack of PPE. Many of these workers had to choose between their own health and paying the bills. Obviously, many decided to leave employment either because of that, you know, choice, or because their children weren't in school anymore and they had to look after them instead. There was obviously a fear of being exposed to the virus and the responsibility of getting their patients sick. At the end of the day, their patients were the most vulnerable during the pandemic. We're talking about older adults and people with disabilities. One of the workers I spoke to in Washington, D.C. did get COVID. She felt fortunate enough to have been paid 2 weeks for the 6-week absence she had to take because of COVID. This is the woman who still to this day feels unwell, who feels the effect of COVID many months later. But yes, as I said, one of the worst consequences of working during COVID was the anxiety and the patients were feeling, and this rubbed off onto the workers themselves, who often said they suffered from anxiety and depression, and that those symptoms were worse after COVID. And as I said before, that if their patient was hospitalized, they would not get paid. Next slide, please. So here, I think this slide tells us a little bit about the magnitude of the issue. You know, where none of us are getting any younger. You know, baby boomers are getting older. People are living longer. People are living longer with dementia. And so there's a huge demand for these caregivers who really are on low wages and suffering from terrible lack of benefits. So here you can see that they'll in 2034, more people will be over 65 than under 18. That people over 65 will double from 2000 to 2040. Also, this aging population is increasingly diverse, with the implications that has. And yeah, so basically it's one of the fastest, some say that it's the fastest growing job sector in the United States currently. And that we're going to need, I believe it's 1 million caregivers in the next 10 years. Next slide, please. So yeah, this is a little bit more about the diversity, the composition of the aging population. You can see here that people over 65, 70% of people over 65 are Hispanic, 18% are African American, 9% are Asian. Next slide, please. Yeah, here again, this boom in this explosion in the older population. Yeah, I think that's pretty clear. Next slide, please. Yeah. So this might not seem particularly exciting, but it's important. And from what I understand of this problem, the crux of the problem is that only 6% of seniors have access to Medicaid. And it's through Medicaid that most seniors pay for home care, because Medicare does not cover home care. So here you can see, you know, most seniors have access to Medicare, but it doesn't actually cover home care in most cases, I think, except for rehabilitation or something like that. So it's really Medicaid that needs to deal with this. At the same time, 52% of seniors do have private insurance, but most private insurance doesn't cover home care either. So what's happening is, you know, you have the 6% who are on Medicaid, and then you have a whole load of other people who are either relying on unpaid family caregivers, or they're having to pay for this out of pocket. And then they're depleting all their savings, and they're ending up on Medicaid. So I wanted to explain that because it was very new to me, and I felt it's very important because it shows the magnitude of the problem and how it really is. It's a systemic issue, especially for families who are dealing with, you know, parents with dementia, for instance, which is something that can last for many years. Okay, so next slide, please. Yeah. So why does this matter? People don't want to think about it. People don't want to think about aging. It's uncomfortable, but it has huge implications for society, and it will affect most of us at some point. And here again, it explains a little bit how the system works. The caregivers are being underpaid. The seniors are not getting the care they need. There are huge wait lists for home care under Medicaid. So as I understand it, each state has operates differently under Medicaid, but a number of states have caps on how many elderly people qualify for home care in a certain year. So they're huge waiting lists. There are a lot of people who would like to be receiving home care who aren't getting it under Medicaid, even though they're eligible for it. There are also, as we said, the family caregivers who are unpaid and who might be losing wages from missing work because they have to look after their father or mother or child or and so on. And as we said before, many families are turning to Medicaid when their resources are depleted. Next slide, please. So yes, when I wrote this, my article, it was published in May. President Biden had just called on Congress to approve $400 billion in funding to expand access to long-term care services under Medicaid. So this was the American Jobs Plan. Since then, as Stacey Sanders mentioned, there's been legislation introduced, namely the Better Care, Better Jobs Act and the Build Back Better Act, which I understand are going through a number of committees as we speak. I'm sure there are people on this call who can tell you a little bit more about that. Next slide, please. And so, yeah, just before I end, again, just a reminder that this really is a systemic and a cultural issue, that older adults in the United States are not as valued as they are in other countries. And it's a little bit of a vicious circle. One expert was telling me, the older adults aren't valued, so anything to do with them is not valued. So their caregivers are not valued either, and they're not being trained properly, and they're not being paid properly. And so, and sometimes the families don't realize this. And so the system really, the solution really has to be systemic and cultural and involve all the actors. It needs to be a holistic solution, right? And so one of the people I interviewed, one of the experts said, as a society, we have to collectively figure out how to support this. And I think that's it. Yeah, thank you so much for listening today. I just wanted to say, obviously, these are conclusions from my report. Obviously, the statistics are not my own. I have so many references that I didn't want to list them all today. Feel free to check out my articles, or shoot me an email if you have any doubts about anything that I've said, and I'm happy to stay in touch with you all. Thank you so much for your time.
Wow, Millie, thank you so much. And I really appreciated the slide. And then came COVID. And I think that, one of the things that we've talked about so much over the last year and a half, and actually NHCOA and all of us even more so talked about just the disparities and how COVID, that exists in our healthcare system. And COVID has really either pulled away the veil or shone a light on, these disparities that have been systemic and have existed for decades. And so your report and all of the information that you have presented, I can't tell you, I was just hanging on every slide, and I think because, we've been saying this so much before in terms of our healthcare workers, being an invisible workforce, being underpaid, undervalued, and the importance to, shine the light on that, because when we went through COVID, and then came COVID, we had the essential workforce, and the essential workforce were typically the workers who show up every day, were underpaid, don't have unions, don't have representation. But when they were, if they're not there, then things just completely stopped. And, I used to manage a solid waste department for our city. And I remember telling, our solid waste workers, our sanitation guys, I said, it's really interesting. If the mayor doesn't show up for work for one day, people are like, oh, well, the mayor's not here. If he or she, is gone for 3 or 4 days, people might get a little kind of like, well, mayor hasn't been here. But maybe after a week, 2 weeks, that they would say, where is that mayor? They haven't been here. He or she's not showing up. They're not doing their job, but 2 weeks later, our solid waste workers would not pick up someone's trash for one day, and who would get the call? What work was valued and important, but yet not as appreciated? And I think that this speaks very clearly to the work that you presented. And so thank you so very much for that. So, and as we all know, the coronavirus, COVID-19, can affect anyone, but reports show that Latinos and other people of color are disproportionately affected amid worsening historical inequities, which we've just talked about. One of the main concerns is of those who were infected with the virus and continue to experience symptoms after their initial recovery. COVID-19 symptoms can sometimes persist for months. The virus can damage the lungs, the heart, the brain, which increases the risk of long-term health problems. These people sometimes describe themselves as long haulers, and the conditions have been called post-COVID-19 syndrome or long COVID-19. Older people and people with many serious medical conditions are the most likely to experience lingering COVID-19 symptoms, but even young, otherwise healthy people can feel unwell for weeks to months after infection. We want to hear more from our next speaker, Dr. Henry Pacheco, who is a physician and an advisor to the National Hispanic Council on Aging. Today, Dr. Pacheco will talk about COVID-19 long-term effects in Latinos. Dr. Pacheco, thank you and welcome again to our webinar. I look forward to hearing from you today.
Yes, thank you so much. That's a very good summary of what I plan to speak. I just want to thank NHCOA and Dr. Yanira Cruz for inviting me to participate in this important event for the benefit of Hispanic older adults. So going to the next slide, objectives. These are some of the topics that I'd like to explore in this presentation. First of all, just a brief overview of the trends of COVID-19 epidemic in the United States, describe some of the signs and symptoms of what is called post-COVID syndrome, or also known as the long haulers. I also want to describe the potential impact of post-COVID syndrome on Hispanic and Latinos in the U.S., and call attention really to a very serious health crisis coming up in the next few months and lasting for years related to this post-COVID syndrome. Next slide. Just thus far, we have registered 42 million cases of COVID-19 and suffered 673,000 of deaths as a result of this epidemic. And as such, we have surpassed the number of American deaths caused by the 3 waves of the 1918 flu pandemic, therefore making the COVID epidemic the most deadly epidemic in the nation. Latinos comprise about 27% of COVID cases and have suffered 115,000 deaths, according to CDC data as of September 2021. But, we should keep in mind that race and ethnicity data is not available for at least 64% in the nation's cases. So this percentage of Latinos involved in at various stages of COVID, it varies significantly among the 50 states. In some states it's very high, in some states lower. So it's there's a lot of lack of data yet based on race and ethnicity. Next slide. Vaccines are really the most effective protection that we have against COVID-19, but they're still underused. As of September 8, the CDC reported that ethnicity is known for about 59% of those who have received at least one dose. And personally, 2/3 of non-Hispanic whites have been vaccinated, 60% of those vaccinated, 10% are Black, of those vaccinated, 70% are Hispanic, so on and so forth. But and also recently there is there are patterns that there's racial gaps in vaccination are narrowing, and because of a significant increase in Hispanic and African American people vaccinating recently. So we are hopeful that more and more people will seek vaccines, which are really the best protection against COVID. One would think that COVID sufferers after 10, 15 days of being, symptom-free, either have been hospitalized or were able to battle this at home, being severely sick, but yet, not sick enough to be hospitalized. You would think that they would be back to their normal lives. However, that's not the case for many of them. Soon they start experiencing serious, very serious and persistent and debilitating symptoms that, so far have persisted for months. There are various names for this condition. Some believe it's a multi-system inflammatory syndrome. Others call it more, informally long haulers. These symptoms consist of severe fatigue, recurrent headaches, fever, dizziness, loss of smell and taste, shortness of breath, difficulty breathing, coughs, persistent cough, episodes of fast pounding heartbeats, chest pains. We also have a lot of people with joint pains, pains in the extremities, pains along very large muscles, and of course blood clotting. Then very seriously, there's also cognitive impairment. Some people having impaired memory, poor concentration, as they call brain fog. Some are suffering from insomnia, depression, anxiety, and many are suffering PTSD-like symptoms. Now, not everybody gets them all, but you get one or two of those, and you can be seriously disabled. And this is a very serious condition that we have to deal with, that is affecting a large percentage of people who have already survived COVID. Next slide. Well, now we're faced with the challenge of providing care for those affected with post-COVID syndrome. If we keep in mind that 21 million COVID cases as of September 21, well, and for example, there's a statistic data that shows that 2 out of 3 non-hospitalized patients have at least one patient visit in the following 1 to 6 months. So these folks who haven't even been hospitalized are already making visits to address some of these complications after they've survived the COVID disease. We know that primary care providers can probably take care of most of these folks, but there's still the need for referrals to various specialties and support services. Without doubt, cardiology, pulmonary, rheumatology, mental health, physical therapy, and other specialist care will be needed and is needed for these patients. And therefore, funding for primary and specialty care for the poor and uninsured will need to be secured urgently. In terms of Hispanics with post-COVID syndromes face significant barriers. First of all, we know that Hispanics have higher rates of uninsured and underinsured. This is traditionally, it's been a problem for decades. Hispanics and other low-income patients with chronic diseases already face limited access to specialty care. Lack of access to specialty care for Hispanic patients with chronic disease persists and systemic. It's been going on once again. I think this has been going on for decades. It's very hard to find for a patient on Medicaid and even on Medicare to find a specialist who will care for them, and much less for those that have no insurance or at all. I mean, securing specialty care is very difficult for these folks. And of course, the quality of care and the quality of life for these new patients with COVID conditions is definitely at risk. Their quality of life will be miserable if they're not able to get appropriate care for very serious symptoms. Keep in mind that some of the symptoms, such as chest pains and things like that, imply that there is inflammatory conditions in heart muscle, and this virus affects the liver, the kidneys, obviously the nervous system. So we're talking about very serious condition. Next slide. Well, in conclusion, there is no doubt that there's urgent need to develop a strategy to prevent and ameliorate long-term effects of this so-called post-COVID syndrome. It's very important. The very important components of this strategy, of course, include increasing COVID vaccinations among Latinos through all the various measures that have been tried, and especially continue fighting this incredible amount of misinformation and politicization of the syndrome. That has been just horrible and has driven people to follow unproven methods of treatment and to avoid vaccines. Next, we need to continue to promote facial mask and physical distancing. That is also a great way to put a barrier between us and the virus. We need to expand and facilitate and raise knowledge about access to monoclonal antibody infusions. So far, fewer than 30% of eligible patients are receiving these treatments, monoclonal antibodies, and let's, highlight that monoclonal antibody infusions are approved by the FDA and the CDC. This must not be confused with any of those other multiple treatments we hear about. This will be being referred by a physician to monoclonal antibody treatment center can prevent someone at risk of serious disease from going from perhaps a mild to moderate COVID to stopping it before it moves on to being a severe disease. So it's very important to start highlighting the monoclonal antibody infusions as a resource that needs to be addressed by physicians and caretakers of people who are coming down with COVID, are still coming down with COVID. And of course, we need to strengthen the health system and services that serve Hispanics, expanding Medicaid, Medicare, has been mentioned. And of course, this not only affects Hispanics, but other minorities and low-income populations, and especially the uninsured. In this category, I do want to highlight the work of community health centers as a very valuable resource. Community health centers supported by Health Resources Administration, HRSA, have a network of about 1,400 centers throughout the nation, and with 14,000 service delivery locations that provide high-quality ambulatory care. These are documented high-quality ambulatory care. They have served 20 million. They serve 20 million patients, and 91% of these patients are low income, 60% are racial and ethnic minorities, and 81% of these patients are uninsured or publicly insured. They have these community health centers have also provided 13 million COVID vaccines and tested over 12 million patients. This is an excellent resource that the nation has that is supported by Health Resource Service Administration, and I do want to highlight that they do play a very important role in controlling the epidemic and also in helping patients overcome this horrible post-COVID syndrome. Next slide. Well, there's no doubt that all of us, absolutely all of us, working together can defeat this epidemic. It takes the work of everyone. No one can be exempt from this, because if you look at the ways that we can prevent COVID and stop COVID, there is a role for each one of us in this battle against this horrible epidemic that has claimed so many lives already. Well, with this, I conclude my presentation. I want to thank you all for listening, and thank NHCOA and Dr. Cruz for inviting me to this event. Thank you so much.
Thank you so much, Dr. Pacheco, and thank you for really highlighting the community health centers, the federally qualified community health centers, and the work of the Health Resources Services Administration under the Department of Health and Human Services. As you say, the clinics are invaluable resources to our many rural communities throughout the country. We talked earlier about the urban-rural divide, just with technology, but there is a real divide in many ways. And these health clinics that are located in many rural communities, really can make a difference, a life or death difference. So thank you for your information and for highlighting that resource for us. I would also I want to thank you, all of our panelists today, for, oh my gosh, just the incredible variety of information. I think you all can see what is included in the report, we hope that our participants, that all of you will go to our website and, get the report and share it widely. We plan to do that ourselves. We plan to share it with our members of Congress and the Senate, with the White House, with Health and Human Services, and we want to share that widely. And again, I think that what sets our report apart from many other reports is the voices that we have heard from our participants that support the data, that support the information that's being collected. So now we're going to be moving to our Q&A session. We still have about 10 minutes for question and answers. I've asked if you do have any questions for any of our panelists that you put them in the chat box, and we'll get to as many of them as we possibly can. And so I do have a question, a couple of questions that I'm going to try and get to. First question I have is, what is the best way to introduce mental health provider to older adults despite their refusal to get emotional support? For example, older adults living in nursing homes already were suffering from social isolation, yet refused emotional support. So if I could ask our panelists, maybe you could put your cameras on, unmute. This question isn't really directed at anyone in particular, but if any of you would like to take, like to address that question, that would be great. Maybe what I'll do is I'll pick Dr. Pacheco.
This is Henry Pacheco. I just want to just give a couple comments that this problem of people not seeking formal treatment, formal therapy for emotional and psychological distress is very common, very, very common. So most of the time, if you want to introduce this type of care, you have to do it gently and not highlight that, it's your emotional problem, psychological problem they're trying to fix. But it is a problem among all populations and a lot of individuals. Many of us just are reluctant to seek mental help for our mental anguishes and other anxieties.
Thank you so much, Dr. Pacheco. Do you have any suggestions for caregivers that may want to introduce that topic to a loved one? If they are talking to their parent or a grandparent, or talking about, I know that that's a difficult topic. I know under different circumstances, and personally in our family, we have a family member suffering with addiction, and it's very difficult to talk about and bring that point of, you need help, or can we get help, or how do we get it? Do you have any suggestions on how people might address that with a family member?
I don't, it's been a problem. So I think just introducing it very gently. I mean, if somebody has chest pains, you can immediately say, hey, you need to see a cardiologist or something. But with mental health, I think you just have to use just gently, smoothly get into it, in the sense that, these are problems that you can get help and this and that, and without bringing up, those words like psychologist, psychiatrist, mental health, but just saying, these are problems like anything else that, you have stomach problems, you get somebody else to look into it. So I don't have a more professional approach other than just gently easing people into it, and it take more than one conversation.
Thank you for that. I appreciate that. Another question I have is, how can we combat the fear of healthcare providers or any type of medical staff to vulnerable communities that historically have been neglected?
Well, I don't know, maybe I shouldn't be talking because, I am one of those in that category, healthcare providers. But I'm speaking about the Latino population, and I really don't, I'm not sure that this fear of healthcare providers is really a significant issue with Latino populations. And once again, I might be, I know I'm in sort of, I'm not going to say in the minority, but I'm one of those who think that this is not a significant problem in the general population. Now, that doesn't mean that there have been abuses and this and that. We are, we all know about it. But in general, you know, the reluctance to see a doctor from Latinos is essentially that, oh my God, they're going to find other things that I don't have. So it's a natural reluctance to having somebody else look under the hood, let's say. But not, you know, so it's very common, but it's not. It's very common, I think, among everybody. Very few people say, "Oh yeah, I'll go to the doctor next week." You know, they, you know, most of us try to hold on to our bodily integrity, and actually are afraid that others, that when going to the doctor, a door will be open, and we'll find out that, oh my God, I have this, I have that, I have this. So many people are reluctant to go to the doctor, actually.
I definitely, I can relate to that one. It's like, you know, I don't want to go to the doctor because then they'll tell me, you know, that I'm going for one thing and then I have to treat 3 others, and I understand that.
Exactly.
Thank you so much. Here's a question from Millie. Millie, do you have any suggestions for improving the value or perception of caring for an older adult?
Thank you for unmuting me. I guess you're, I'm not sure who asked that question, but I guess you're hoping from that the answer is in the media, that the media has a responsibility in putting a spotlight on these issues. I imagine that's why I'm being asked that question. All I can say is that, you know, it's a topic that's interested me. I've written about caregivers twice. I have elderly parents myself. I am aware that there is ageism, you know, that it's a reality, and it does interest me. And I do. I think you know, we all have a responsibility to draw attention to this, and you know, the media is part of. It's one of those that is, you know, is responsible just as much as everyone else. Yeah.
Thank you. I appreciate that. I think that what I hear from your answer is actually one of the very reasons why we at NHCOA host the webinars, host the Capitol Hill briefing, have conducted this report, is that in order to really raise attention and, you know, have people talking about it, is we need to just do that, call attention to it. We have webinars, we write reports, we get in front of committees. I know that Dr. Cruz has testified in front of several committees in Congress, you know, and putting that information out there as much as we possibly can. So what can we do as an individual? You know, I feel that way sometimes myself. You know, I work from home sometimes, and I'm in my, you know, my little bedroom office, and it's like, you know, I'm only one voice. How can I, you know, bring attention to something? But I have a phone. I can make phone calls to mayor's offices, to clinics, to county commissioners, you know, and raise that and tell them just how important these services are. And I think if all of us raise our voices, one person at a time, you know, there's the power of one. One person will call one person, and then you call 3, and then you call 9. And so really raising that attention. And I wanted to also highlight, Iran Rivera had also put in our chat boxes when we response to the last question on mental health, is that there is a lot of stigma among Hispanics about mental health. And she has conducted many groups and research about it. And it works really well to use the term salud emocional instead of mental health. So I really appreciate that. I think a lot of times, you know, the words matter. So how we, you know, using the term salud emocional instead of, you know, mental health. And family members, she also writes, play a big role in addressing home health care aides and caregivers. So please, you know, write to Congress as an advocate. If you're a caregiver and you're in the home, perhaps the person you're caring for can't write the letter, but you can as their advocate and their caregiver. And so I just wanted to say, you know, I know we have a few more questions. They're in the chat box, and we can post those also on our website and respond to you. But I just wanted to, again, thank all of our panelists. Thanks our sponsors. I wanted to thank NHCOA staff for putting this together. And I wanted to thank all of you for joining us for today's virtual event. What can you also do? We talk about things that you can do is, raise your voices. You can help NHCOA's work. You can donate through networkforgood.org to NHCOA to help us, do more webinars to continue our work. And so we always appreciate your continued donations and support. We are a nonprofit organization, non-governmental organization, and we work as advocates. So we really appreciate community support. We want to thank, again, all of our sponsors because they too help pay for our webinars. And our work continues every day, and together we are stronger. I mean, it really does take all of us. So we want to continue advocating for programs and resources to better support older adults and their caregivers. And together we can make a difference, and that means together working with all of you. So again, thank you to NHCOA, thank you to our sponsors, to our panelists, and all of you for joining us today. We hope that you enjoy the rest of your afternoon and this lovely fall. And remember that we're all advocates and we can do make our voices heard. Thank you very much.
Thank you.
Thank you so much.